In the last month, just under 3 million kids in the U.S. have tested positive for COVID-19. The number of new infections is dropping sharply, but this is a challenging time for parents of younger children who are not yet eligible to be vaccinated. The Fox Medical Team's Beth Galvin has the story.
Pediatrician Dr. Jennifer Hsu, who's in Decatur, says she's still seeing more kids coming in with COVID-19 than any other respiratory virus, but the overall numbers are way down. And we asked her what she's telling parents of younger children who are too young right now to be eligible for the COVID-19 vaccine.
It could be mid-April before the FDA makes a decision on whether to authorize a low-dose vaccine for children under the age of 5. And until then, Children's Medical Group pediatrician Dr. Jennifer Hsu is advising her parents to keep using several layers of protection to keep younger kids from getting infected with the Omicron variant. She says start by making sure that everyone in close contact with your toddler or preschooler is fully vaccinated.
We think about like a cocoon effect. If everyone else around you is vaccinated, that's probably the best thing you can do until your child's eligible.
And with the Omicron surge waning and many adults taking off their masks, Dr. Hsu is advising parents of younger kids to stay vigilant. Having kids 2 and older keep wearing their masks in public indoor settings where the virus is more likely to be circulating.
Don't send your kids to school sick. Do things outside when possible. Anything with increased ventilation is really helpful.
And if possible, Dr. Hsu says keep younger children out of crowds, but smaller gatherings like indoor play dates may be okay right now.
I think it really depends on your comfort level and how well you know the people that you might be doing play dates with. Maybe the families are vaccinated, maybe they attend a school or daycare where they're masked, so that would reduce somebody's risk. If it's an occasional thing, you might consider doing a home COVID test before getting together.
Spring break will likely come and go before a vaccine for younger children is available. So what about traveling with younger kids?
I think in general, car-based trips tend to be safer than air travel because you're not in airports with big crowds. So just think about every step of the way, how crowded is it going to be? What are the risk factors? And if people keep masking well on airplanes, I think that's a really good plus as well.
Dr. Hsu says most of the kids that she's seeing have mild COVID-19 infections. The most common symptoms are a cough, a runny nose, and a fever. For your Fox Medical Team, I'm Beth Galvin.